The president has scientists working on a vaccine and a treatment for the coronavirus, but even with thousands of people dying, there are some people who don't trust what scientists may come up with.
It's a mistrust of medicine in general, especially in the Black community that goes back decades, maybe even longer than that. And joining us tonight is the director of Tuskegee University's National Center for Bioethics in Research and Healthcare, Dr. Rueben Warren. Welcome, Doctor.
Thank you.
Dr. Warren, this distrust goes back to the 1930s, isn't that right?
It really goes back further than that, but specifically with the United States Public Health Service syphilis study at Tuskegee, it started in 1932. Mm-hmm.
And can that kind of hurt ever be repaired, that kind of trust? Because we hear often, especially among the Black male population, that we're afraid to go to doctors most of the time just for very routine things.
Yes, we see the issue of trust is embedded or is grounded in the notion of trustworthiness. So you can't ask for trust, particularly if the trust has been violated over the years. And so the paradigm must shift from trust to trustworthiness. And so those who are seeking trust must prove themselves trustworthy.
If we haven't had this trust for so many years, dating, as you said, before even the 1930s, how can that trust be regained?
Fundamentally, you have to engage trustworthy institutions and trustworthy individuals. For example, historically, Black colleges and universities have a history of trustworthiness. And so to really gain trust within the Black community, you need to reach out to HBCUs particularly. And I specifically talk about HBCUs because even if you are African American and you are employed or working at an untrustworthy institution, that's a history of not being trustworthy, and you lose your credibility. So the HBCUs are critical in this conversation.
We've heard stories and read the history over the years of experimentation, which has gone on in the Black population, more than one, several different situations where that has happened before. Does that factor into our mistrust these days?
Absolutely. Absolutely. It's grounded in reality. Not only is the U.S. Public Health Service syphilis study an example, but there's a long litany of abuse. You've heard of the quote-unquote father of gynecology, Marion Jane Sims. In the late 1800s, early 1900s, he did experiments on enslaved Black women. He's called the father of gynecology. And he experimented on enslaved women without anesthesia over and over again to perfect his instruments in OB gynecology.
And the same goes for Sloan Kettering. Am I correct about that? Those two doctors who were experimenting on cancer and they were dismembering people of color to try to do their research. Is that correct? Or
there's a history of abuse, and it seems to me that the vulnerability of the Black population goes over and over again. We can reach back to 1619, and as we came to this country, issues of abuse over and over again. Black bodies are worthless in this country.
So how does all this factor in now to what we're experiencing with this COVID-19? How are African Americans affected by all of this?
If you look at the data, don't look at the numbers, look at the trends. And the Black population across the country is disproportionately impacted, both in infection and in death. And early on, you heard that they were not collecting data. Well, I will argue that they were collecting data, they just weren't sharing it because we knew the trend. So over and over again, across the country, you see a disproportionate burden of infection and death in the Black population. Look at the percentages of in certain states and look at the deaths, and you'll find the disparity continues. And one would argue, well, maybe it's because we disproportionately suffer from chronic diseases, diabetes, a heart disease. But yes, that may be true. But look at this, the burdens that we're sharing right now. Who are the frontline workers? And so we're continuing to expose African Americans to the threat of this coronavirus. So the game does not change.
Dr. Warren, so what should Black people do right now then, knowing this, to protect themselves from coronavirus?
The recommendations that are coming from CDC are, one, to social distancing and to wash your hands, very basic. But I would argue social distancing is not the issue. It's physical distancing. And we've got to talk about social interaction while engaging in physical distancing. If we're socially distancing, then we're creating a whole new set of problems, a whole new set of mental health problems. So physical distancing is important, and social distancing is something we must engage in when we can. But wash your hands, very basic. People don't want to believe it's that simple. Wash your hands repeatedly. Wear a mask repeatedly. So those are the things we can do. That's beyond medical care, if you will. Those are basic principles of public health that are important regardless of the condition that we find ourselves.
All right, Dr. Warren, thank you so much for that insight, and thank you for joining us this evening.
Absolutely. Thank you.
Have a good night, sir.